Dried blood spot screening. A few drops of blood are collected from the newborn's heel. Blood is collected by placing drops onto the pre-printed circles on special filter paper of the DBS card. The Georgia Public Health Laboratory tests for 35 heritable conditions, some of which are listed here. Georgia's newborn screening program added an additional pre-printed spot in 2024, increasing the number of spots from 5 to 6. Dried blood spot screening results for 2022. A few drops of blood are collected from the newborn's heel at 24 hours post-first feed and sent to the Georgia Public Health Laboratory to test for more than 30 genetic conditions. 98% of newborns had the dried blood slot screening. 9% of those newborns had a presumptive positive screening result. 3% of newborns were diagnosed with genetic newborn screening conditions. The three most identified and diagnosed newborn screening genetic conditions among screened newborns were hemoglobinopathies 40%, congenital hypothyroidism 29%, and cystic fibrosis 7%. Timing of dried blood spot specimen collection. 24 to 48 hours after the first feeding or prior to the newborn's discharge if the newborn is discharged before 24 hours of age. Other circumstances and considerations. Non-viable newborn. It is still appropriate to collect a newborn screening specimen for newborns unlikely to survive to 24 hours of age. Newborn requiring transfusion. Specimen should be collected before the transfusion unless it is determined that the blood collection will worsen the newborn's condition. Newborn screened prior to 24 hours of birth. Newborns should receive a repeat screening between 48 to 72 hours of life to identify false negative screenings caused by early screening. Dried blood spot collection in special populations. NICU and special care nursery admissions. Upon admission, collect the first DBS specimen, regardless of age and before any other treatments are begun except respiratory. Between 48 to 72 hours of life, collect a second DBS specimen from infants initially tested at less than 24 hours of age at the first screen. And at 28 days of life or at discharge, whichever comes first, collect a third DBS specimen from infants who were less than 34 weeks gestational age or 2,000 grams at birth. Transferred infants. Birthing facilities transferring an infant to another facility should document in the medical record whether the DBS was collected. The receiving facility should note in the medical record whether DBS has been done. If it was not done prior to transfer, the receiving facility should perform the DBS upon admission and follow any newborn screening schedules, as appropriate to the status and treatment of the transferred infant. Transfusions, blood products and extracorporeal membrane oxygenation, ECMO. It's critical to collect a DBS specimen prior to the first transfusion, ECMO, or blood product administration if possible. A repeat DBS specimen should be collected 120 days after the last receipt of blood product from infants who received them during the newborn period. A specimen collected after 120 days post-transfusion will no longer contain donor cells that could result in false negative test results. ECMO should be specified as a transfusion on the newborn screening DBS card by facilities submitting specimens. Low birth weight infants. Low birth weight infants, including those less than 2,500 grams at birth who were tested before 24 hours of life, should have a screen at 48 to 72 hours. In infants less than 34 weeks gestational age or less than 2,000 grams at birth, an additional third screen at 28 days of life or discharge, whichever comes first. Parenteral nutrition, PN. Screening should be done before PN is administered. Post-PN DBS specimen collection should be collected 48 to 72 hours after parenteral nutrition is discontinued. Older infants and children. If the infant was not previously screened or the screening results cannot be obtained, collect a specimen if the infant is less than 12 months old. This is an overview of the newborn screening dried blood spot card. There are 4 copies. The parent or guardian copy. The state lab data entry copy. The submitter's copy. And the state lab copy. Newborn screening dried blood spot card sections. There are 2 main sections of the dried blood spot card. The demographic section, which includes patient information and requested information. And the blood collection area, which is the pre-printed circles that are to be filled with newborn blood drops, pictured here on the right. Dried blood spot specimen cards. It's important that each of these areas is filled in completely. The top area is the submitter, followed by the pediatrician, the baby's information, mother or guardian's information, the results of the hearing test, form number, and the CCHD results. Card expiration date. Check the newborn screen card's expiration date before collecting the specimen. Expiration date is located on the left side of the card. Please do not use an expired card to collect the newborn screening. KID or form number. Georgia transitioned to an updated 12-digit alphabetic and numeric sequence in 2024. Newborn screening DBS card begins with Georgia State abbreviation, GA. Newborn screening DBS KID or form number is located on the right side of the card. Submitter. Newborn screening report will be mailed to the submitting healthcare provider listed on the NBS DBS. Invoices will be sent to the submitting healthcare provider. Submitter code is assigned to individual facilities by GPHL. The best practice is to display your individual facility submitter code near the NBS DBS collection area to ensure that the correct information is entered. Pediatrician after discharge. Importance of accurate information. Newborn screening reports will be mailed to the provider who is listed on the NBS DBS card. Follow-up programs can notify the provider about abnormal results and provide additional interventions. Ask the parent or guardian who will care for their newborn after discharge. Enter the pediatric provider's contact information. Baby section. Accurate information is critical. Reference intervals can be based on gestational age, birth weight, age at time of collection. Please verify the dates to ensure correct month, day, and year were entered. Meconium ileus checkbox. Meconium ileus is a blockage in the newborn small intestine or ileum caused by thick meconium. Additional testing will be recommended for infants who have MI checked, as they are at high risk for having cystic fibrosis. Studies have also shown that 80 to 90% of infants with MI do have cystic fibrosis. Check the meconium ileus box if the newborn has the diagnosis of MI at the time of collection. This was added in 2024. Parenteral nutrition. Mark the parenteral nutrition yes checkbox for infants on total parenteral nutrition, TPN. TPN may interfere with the newborn screen by causing elevation in amino acid levels, which results in possible false positives. Collect the newborn screening DBS before initiating TPN, if possible. Mother or guardian. Contact information is used by the delivery facility and the follow-up programs. Inaccurate information could delay the notification process for unsatisfactory specimens that need to be recollected, or abnormal results that need urgent interventions or confirmatory testing. Hearing. Enter the final hearing screen date. Enter the result for the right ear and left ear. Select the screening method used. Select the reason the newborn was not screened. If transferred, enter the name of the facility the newborn was transferred to. If your facility reports through an alternative method like the electronic birth certificate worksheet or file transfer, please do not fill out this section of the card. Just leave it blank. CCHD results. All pulse oximetry screening results must be reported on the newborn screen dried blood spot card in the CCHD results section. Do not hold the dried blood spot card if CCHD screening results are not available and the DBS card is ready to be shipped. 6 pre-printed blood spot circles. Filter paper is used to collect whole blood for the dry blood spot screening. There are 6 pre-printed circles which allow for screening of new conditions. It is important to fill all 6 circles. The best practice for filling 6 spots is to warm the heel and position the newborn's leg at the level of the heart or lower to increase venous pressure. Newborn screening dried blood spot specimen collection equipment. Gloves. Alcohol pads. Heel warmer. Lancet. Sterile gauze pad. And newborn screening dried blood spot card. Dried blood spot specimen collection. Number 1, wash hands and wear gloves. Number 2, fold back the DBS card cover sheet to expose the filter paper. Avoid touching the pre-printed circles on the filter paper. Number 3, swaddle infant to reduce movement. Number 4, position newborn with feet lower than the level of the heart. Number 5, warm the newborn's heel. Number 6, clean the puncture site with an alcohol pad. Number 7, use a sterile single-use retractable lancet to make an incision in the areas indicated on the diagram on the right. Average weight newborns and older children should not exceed puncture depth of 2 mm. Preterm and low birth weight term newborns do not exceed a puncture level of 0.85 mm. Number 8, wipe away the first drop of blood with sterile gauze. Number 9, allow a large drop of blood to form. Do not milk or squeeze the puncture site. Number 10, lightly touch the filter paper to the blood drop and fill each pre-printed circle with one single drop, allowing the blood to soak through completely. Number 11, apply blood to one side of the filter paper only. Fill all the pre-printed circle areas. Do not layer successive small drops of blood in the same circle. And avoid touching or smearing the blood spots. Number 12, if blood flow is diminished, repeat steps 3 through 9 with sterile equipment. A satisfactory specimen has circles that are completely filled to the outer edge and evenly saturated. The reverse side looks the same. And all demographic information is provided. Please allow the specimen to air dry for at least 3 hours on a flat surface, away from direct heat and sunlight. Best practice. Always change gloves between newborns. Alternative methods of DBS collection. If there is inadequate blood from the heel to complete specimen collection, alternative methods of collection can be used. Venous, arterial, and umbilical catheter blood are some of those. If an alternative method is used, the drop should be applied to the DBS card in a similar manner to the traditional procedure. Allow the blood drop to pool at the tip of the syringe or catheter, and apply one drop to the center of the spot. Unsatisfactory dried blood spot specimen examples. Layered specimen. Blood here was applied multiple times to the same circle, or the circle was filled on both sides of the filter paper. Insufficient quantity of blood. Circles are not completely filled. The reverse side is often poorly saturated, as shown. Poor saturation. The reverse side of circles are not completely filled as shown in the examples. Heel pressed against the filter paper. Specimens often have poor saturation on the reverse side as shown. Blood is chafed, abraded, or torn. This can happen when blood is supplied using a capillary tube or other device. Serum rings. Possible causes are anemic infant, excessively squeezing areas surrounding puncture site, allowing filter paper to come into contact with alcohol, applying blood to filter paper with a capillary tube. Newborn screen DBS specimen drying. Allow the newborn screen DBS card to air dry for at least 3 hours. Do not stack newborn screen DBS cards. Keep the newborn screen DBS specimen card away from direct sunlight. Do not refrigerate. And send DBS cards to GPHL within 24 hours of collection. Quality check. Always perform a final quality check before the newborn is discharged. Demographic data are complete and accurate. Optimal quantity of blood is evenly applied on the 6 spots on the newborn screen DBS card. Collection timing was appropriate, for example, collected at the recommended timing, collected after adequate feeding, etc. And dates are accurate. Dried blood spot results reporting requirements. Ensure all fields are completed on the DBS card. Include CCHD and hearing results if available. Do not delay DBS card shipment if results are unavailable. Parental refusal should be marked on the DBS card and submitted to GPHL. DBS specimens must be shipped within 24 hours of collection. Best practice. Consider implementing a quality control check, where each newborn screening DBS card and/or additional reporting method is reviewed by the charge nurse, unit clerk, lab technician, to ensure that it has been fully completed prior to being sent to GPHL. The following flowchart is the Georgia Newborn Screening Program dried blood spot specimen collection process, which can be downloaded from our website at dph.ga.gov/nbs. Resolving unsatisfactory specimen results. GPHL will notify the submitter about unsatisfactory results. Missing information. Provide the missing information ASAP. Testing will be delayed until the information is provided to GPHL. Unsatisfactory specimen. Recall the infant, collect a new dry blood spot specimen, and submit the card to GPHL. If the infant has been discharged, then the birthing facility shall be responsible for contacting the infant's pediatrician, or the infant's parent, or legal guardian, to arrange for the collection of a second specimen. NBS/DBS correction. It is the responsibility of the birthing facility, and the listed clinician, to contact the parents or guardians of an infant, from whom the initial specimen was unsatisfactory, to coordinate a repeat NBS/DBS specimen collection. Submitters who have failed to include information on the NBS/DBS card that is required for performance of testing will receive written notification and a request for corrected report. Form submitters are required to complete the correction form, print and sign the form, and fax the form to the laboratory at 404-327-7919, so that the results from the submitted specimen can be finalized and reported. Accessing dried blood spot results. Mail. The dry blood spot genetic report will be mailed to the submitting healthcare provider and the pediatrician after discharge. E-reports. Licensed physicians can request access to the Georgia Public Health Laboratories web portal to access newborn screening results 24/7. SENS. Authorized providers can access newborn screening results online through the State Electronic Notification Surveillance System, SENS. DPH. Providers seeking newborn screening results, please email DPH or fax a request. E-reports search function update. Newborn dried blood spot specimen report search options. Kit and form number. Or combination of birth demographics, mother's date of birth, newborn's date of birth, birthing facility, mother's last name. In 2024, the e-report search screen was updated to add additional search functions. Follow-up for abnormal DBS results. The Georgia Newborn Screening Program collaborates with a network of medical systems and organizations to follow up with abnormal screening results. Emory University Newborn Screening Program. Augusta University Sickle Cell Program. Children's Healthcare of Atlanta Sickle Cell Program. Grady Health Systems Sickle Cell Program. Sickle Cell Foundation of Georgia and Hemophilia of Georgia are some of these.